Recently, the American Heart Association revealed that Vascepa lowered cardiovascular risk by 25% beyond cholesterol management alone. This reduction has the potential to help millions of patients with diabetes and heart issues. Here with more about the recent study is Dr. Deepak Bhatt. Welcome.
Thank you for having me.
Happy to have you here. So tell us about the Reduce It study and what it revealed. I know that you just discussed it at the American Heart Association conference this past week.
That's right. It was just presented this past Saturday and published in the New England Journal of Medicine. What we did in Reduce It was take 8,000 patients with elevated triglycerides, that's a type of bad fat floating around the blood, and randomly assign them to a drug, icosapent-ethyl, or a placebo, and followed them for about 5 years. And what we found was a 25% reduction in important cardiovascular events, including a 20% reduction in dying from cardiovascular causes, as well as a 31% reduction in heart attack and a 28% reduction in strokes.
So why was this news so groundbreaking?
Well, I think really we're at the dawn of a new era in cardiovascular prevention. What we found was that in people with elevated triglycerides who were already on statins for controlling their bad cholesterol levels, statins of course are commonly used to reduce cardiovascular risk, we could further reduce their risk if they were on icosapent-ethyl, this drug, versus a placebo. So this really is an incremental advance above and beyond what's already available to reduce cardiovascular risk.
So why does cardiovascular disease remain such a problem here in the United States?
Cardiovascular disease is still the leading killer in the United States and in most regions of the world. And that's because while we've made progress on some fronts, like smoking rates coming down, for example, we're also losing grounds on other fronts. The average weight in America has gone up, for example. That's fueling a diabetes epidemic. That, in turn, is fueling a cardiovascular epidemic. So on the one hand, advances in things like smoking cessation rates, also statins are a big advance in terms of reducing bad cholesterol levels, but there's still other things that drive cardiovascular risk, and it turns out one of those may be triglycerides.
So where can viewers go for more information both on the Reduce It study and also what it is that you're speaking about now, about their overall health?
Absolutely. Sure. So this study, which I really think is probably the biggest breakthrough in cardiovascular prevention since statins came out for lowering LDL or bad cholesterol, was published in the New England Journal of Medicine. That's one of the leading medical journals. And the paper is available online at www.nejm.org. But more practically speaking for your viewers, I think the first step is to see, do they have elevated triglyceride levels? So just like everybody knows their cholesterol levels these days, you really ought to know your triglyceride levels. And if you don't, you should talk to your doctor. And if your levels are elevated, you should probably still talk to your doctor and see if you're at increased risk for heart attacks and strokes. And if you are, this drug, icosapent-ethyl, might help reduce that risk.
All right, Dr. Bhatt, thank you so much for joining us. Really appreciate you being here. And we'll be right back with more Midday Maryland right after this. Stay tuned.